Still wondering why you're seeing all the ads on TV for Medicare Advantage or getting clutter in the mail? Well, we're going to explain why that's still happening. Stay tuned. Hey everyone, this is Rick McDermott here with Senior Solutions Group, and we are here to talk to you about the Medicare Open Enrollment Period, which is different from the Medicare Annual Election Period. Sound confusing? Well, we're going to explain it all right now. If you haven't done so already, please feel free to subscribe and share this with a friend. So every year between October 15th and December 7th is the Medicare Annual Election Period, which affects people who are wanting to change their Part D drug coverage, Medicare Part D standalone drug plans, where Medicare is the bus driver and the insurance company, a supplemental plan, is just along for the ride, paying the 20% and the hospital deductibles that Medicare doesn't cover. Medicare Annual Election Period, which goes from October 15th through December 7th, allows you to change your Medicare Advantage plan and go back to regular Medicare, and you can apply to buy a supplement if you qualify, or you can change to a different Medicare Advantage plan, or you can go from a Medicare supplement to a Medicare Advantage plan. It's kind of a free-for-all, kind of a once-a-year do-over period for anyone who's on Medicare. Those that are new to Medicare, you have your own enrollment period, which is 3 months prior to your birthday month, usually when you turn 65, the month you turn 65, and 3 months after you turn 65. Those of you who work past 65 and elect to keep either your own insurance or your spouse's insurance through their employer, you can work as long as you want with no penalty. Now, once you hit December 8th, the period is locked in. For most people, you cannot change your drug plan in most cases unless you qualify for a special election period, which is for people that are moving out of state, moving to a different county, maybe if you are going back to work, or if you're losing work insurance, or if you have a low income subsidy based on your income. Now we are in what's called the open enrollment period. Open enrollment is for people that are currently only on Medicare Advantage plans. So with a Medicare Advantage plan, you have a set timeline when you can enroll in a plan. Either when you're new to Medicare during that 7-month initial window, when you lose your employer plan within 63 days, or when you're brand new to Medicare Part B, if you've had Part A only, which is the hospital part of Medicare, and you add Part B later on, you can sign up for a Medicare Advantage plan before your Medicare Part B effective date. Once you're already on Medicare and you've signed up for a Medicare Advantage plan, then you can change that plan from January 1st through March 31st. Why am I getting all this clutter in the mail? Well, guess what, folks? People are trying to get you to change your plan, sometimes by hook or by crook. You might still see ads with Joe Namath or Jimmy Walker, some of those celebrities, those nonstop carnival barkers that are out there trying to get you to get all riled up and give you all the free stuff that you're entitled to. Well, it may not be exactly the way it seems on TV, and usually it isn't. Unless you qualify for Medicaid, you're not going to get free this, free that. Everything's free, 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 free. So be careful. I had a client that was on a plan. She was on the Medicare Advantage Choice plan through United Healthcare, which is a PPO plan, which allows you to go to any doctor that accepts Medicare. She called an 800 number. She said, Rick, I think I made a mistake because now I'm paying a premium per month, where before I was only paying $19 a month. I'm paying more for my plan. So we figured out what happened. I said, did you call some 800 number? And she said, yes, I did. So she actually ended up getting switched for the month of January of 2023. So we were able to, during the OEP period, put her back on the plan that she really wanted, which was her other plan that she's had before she called this 800 number. So we're on Medicare.gov and we can see exactly what happened. This person put her on a plan We're going to put in her zip code here. And she doesn't qualify for any extra help. So we're on Medicare.gov right now, which is the official site for Medicare. So she was on the United Healthcare plan. So we're going to go through all the different plan options in our area. You can see there's about 24 Medicare Advantage plans to pick from in our county. And she was moved from the $19 plan, which is a PPO, which lets her go to any doctor that accepts Medicare, to the Plan 3 with the same company for $43 a month, which is an HMO plan, which has more network restrictions. So a lot of the benefits are similar, but when it came to finding out how much her medications would cost her, she would have ended up paying an extra $250 for her medicine for 2023. And she would have fewer options for going to doctors. So this agent that she contacted, she didn't know who he was, she didn't know how to contact him, she didn't know where he was located. A lot of these call centers, these giant call centers, they're not all bad, but you got to be careful. You really got to do some research. Who am I talking to? How long have you been doing this? Are you brand new to the business? Are you looking out for me, or are you looking out just to make a commission? So during the annual election period, if you have an advisor or an agent that you've worked with over the years, feel free to reach out to them and say, hey, am I still on the best plan? Make them answer that question and make sure they tell you why you're on the best plan. Well, when we ran your drugs, yes, it's showing that you're still paying the least amount for your drug plan. All your doctors are in network. The plan's working good for you. How do you feel about the plan? Make sure they're asking you about how the plan's working for you. Make sure you understand what your copays are, not only today, but what if your health changes? Are you able to withstand a out-of-pocket expense of up to $6,500 or more out of your pocket? Or would you be better served looking at a Medicare Advantage plan? A Medicare Supplement plan. During the open enrollment period, you can change back to Medicare, get a standalone drug plan, and go with a Medicare Supplement plan, which pays whenever Medicare pays. So in this case, you would not have a substitute bus driver or an insurance company running the show. You'd have Medicare running the show with a supplement. It's not one size fits all. I'm not going to tell you the supplement's going to be best for you in all cases. Maybe you may not be able to afford a Medicare supplement plan. The premiums are higher for Medicare supplement plans. Maybe you're better served on a Medicare Advantage plan. What we do is we do our due diligence. We will look up your medications. We will help you. We'll reach out to you on an annual basis to make sure you're always on the best plan. A lot of the people we talk to say, I've never heard from the person that enrolled us in a plan. I don't even know how to get a hold of them. I don't even know if they're still in the business or not. Well, every fall we do an annual workshop for our clients, which we can review all the changes in Medicare, all the different plan options, whether you're here locally where we live in Yakima, Washington, or if you're anywhere in the state of Washington, anywhere in the Northwest, or in several other states. We are always available to reach out. You can reach out to us. We are here for you. We'll respond to your call the same day, usually within an hour or two. You're never bothering us. So don't hesitate if you have any questions. If you're a current client, we want to hear from you. If you're not a client yet, or if you have a parent that needs help, reach out to us between now and March 31st. That's the end of the open enrollment period, to make sure you're on the best plan. We are here for you. We are Senior Solutions Group, and have a blessed rest of your day.